Hello, welcome back in the channel of Clinical Care Insight. We started a series of lecture, on the neuroanatomy and neurophysiology, and we already have discussion over the normal, you can say the outline of nervous system, that is the basic introduction about the nervous system. Then we seen that nervous system is composed of mainly the cells, and those structural and functional cells is called as the neurons. Understood? Then we seen that neurons are not only the cell which is present in the center, you can say the entire nervous system. There are other cells which is helping the neurons, and we term those cells as a neuroglial cells. Understood? No problem. Then we seen the differences between the neurons and neuroglial cells. The fundamental difference we made is that the neurons is it's a excitable cell, very good, and the neuroglial cells is a non-excitable cells. Understood? And there are other marked difference as well. Then we seen that there are classification for ease of study, for facilitation of study. We are dividing the entire nervous system into the two parts. The first part we called it as the central nervous system, where the brain and the spinal cord is present, and in the next part that's called the peripheral nervous system, where the somatic nerves, the somatic nervous system as well as the autonomic nervous systems are present. And there are further classification of the autonomic nervous system, somatic nervous system. Understood? There is a further classification of the brain and spinal cord. We have all this discussion already. Understood? Now we also studied about the layers of the brain, layers of the entire central nervous system. We called it as meninges. It's a membranous in nature. The meninges are membranous in nature, and it's a protective covering of entire you can say the central nervous system. Then we also seen that there are hematomas formation, there are hemorrhages. These layers, these three layers of the brain, they are clinically important just because they are creating a kind of pressure. Sometimes there is a absolute pressure, and sometimes there is no any pressure. We termed those spaces as a those spaces is a pathological space, or we can say the non-potential space. Understood? No problem. Now in today's class, can you guess what things we will discuss? Very good. We will discuss today about the CSF. In today's class, basically we will discuss about the CSF. Probably many of you already know about this fluid. Can you elaborate this name CSF? Very good. It's a cerebrospinal fluid. It's a cerebrospinal fluid. So we have the discussion over this, and my friends, this CSF is clinically very, very important. It's one of the most important kind of fluid in our body. See, in our body there are so many fluids, isn't it? There are so many fluids, and every fluid have their own importance. Every fluid have their own importance. CSF is also one of them. But why they are most important, I am saying there is a reason, because they are present in our higher system. It is present in our higher system, which is main control and command organ of our body. Understood? So here is your today's outline. First we will deal with the introduction, then the properties of CSF, composition of CSF, then formation of CSF. Understood? Then we will also see about how this CSF is circulating. Since focus on the fluid name, it's a cerebrospinal fluid, means it's present in the cerebral environment, and a spinal environment as well. This means there must be a kind of circulation. So we will deal with the circulation. Then we will also deal with the absorption. See, in our body there are fluids. As I told you, there are numbers of fluid which is circulating, but every fluids have their, you can say, a kind of lifespan, and there is a need for the again renewation, you can say the reformation of those fluid. For that reformation, absorption is first needed. If there will no any absorption, then how the fluids will form, how the fluids will reform once again. Then we will see about the function. Okay, if it is present in the central nervous system, it must carry some functions, no, and it's carry a beautiful function. Okay, I'm not revealing right now, we will see in during the lecture. And then we will see about the abnormalities. Okay, good things also have some bad parts, isn't it? So this CSF, sometimes they become, you can say, over secretion, their volume increases and there is no any passage to go. Okay, and if something is accumulating, okay, and then there will be an increase in the size. Okay, and that result into the abnormalities. Understood? So now first start with the introduction. Okay, and about the CSF. See, the first thing you should remember about the CSF is that it is a colorless. Okay, it is a colorless clear fluid. It's a colorless clear fluid. Write it down. Colorless clear fluid. Okay, colorless clear fluid. Now second thing you should remember about the CSF is that these CSF, they are present in both the part of the central nervous system, that is your, you can say, the brain part and spinal part. Okay, brain part and spinal part, in these both places they are present. Understood? So write it down. As far as their presence is concerned, okay, where they are present in the brain environment. Okay, brain environment and spinal cord. Spinal cord. Clear? Understood? No problem. Now the third point which is related with the cerebrospinal fluid is that this is a kind of extracellular fluid. What now? You're thinking, what do you mean by the extracellular fluid? Simple. The fluid which is present outside the cell environment, that fluids are called as the extracellular fluid. So this is a kind of, okay, this is a kind, or you can say the type of, kind of extracellular fluid. Getting my points? No problem. Now, where they are circulating, see, brain have the so many compartmentalizations, okay, and spinal cord also have the compartmentalization, but where they are circulating, so for that I just roughly draw one diagram. I will draw diagrams later. See, this is your central nervous system. Okay, and you've seen that there are three meninges, three layers, okay, which is present in the, you can say, the present in the form of covering of entire central nervous system. So the first layer, which is very much connected with the brain tissue, okay, lying down on the brain tissue, that's called your pia mater, isn't it? Yeah. Okay. So this purple color as I am showing, it's your pia mater, okay. And after the pia mater, there is one wave-like structure. Okay, wave-like structure that's we termed. Did you recognize this layer? Yeah. Very good. It's your arcuate matter. Okay. Now, and one more layer is present, which is a tough mother. Yeah, very good. It's your double layer dura mater. It's your double layer dura mater. Okay. Now, CSF is basically you can say first you have to understand where they are formed, okay, and then go and understand how they are circulating. So yeah, now see, the CSF is mainly, you can say, present in the cerebral environment, okay. These are called the hollow space present in the brain and spinal cord, okay, and these spaces are termed as the ventricles. Write it down. This space is termed as ventricles, okay. These spaces are termed as the ventricles. There are hollow spaces present, understood? And this space, okay, contain one of the most important structure, okay, one of the most important structure, and that structure is called as, or we can say it is termed as choroid plexus, okay. This is termed as the choroid plexus. This is, some choroid plexus is also present here, okay. This is termed as the choroid plexus. It's not that much narrow, it's a small diagram. Understanding? Now first you should write their name. It's a choroid plexus. Now you have 4 ventricles. How many ventricles you have? 4 ventricles. These 2 ventricles, okay, these 2 ventricles is termed as lateral ventricles, okay. The first means this is the first ventricle, second ventricle, okay, this is the third ventricle. So you have how many ventricles? Yeah, 4 ventricles, okay. 2 lateral ventricles, okay. These lateral ventricles, they communicate, okay, with the third ventricles via one window, here is one window, okay, and this window are called as the foramen of Monro, okay. This is termed as the foramen of Monro. Write it down. This window, okay, is called as the foramen of Monro. Foramen of Monro. See, their name is derived from the scientist who discovered it, okay. So this window is called as the foramen of Monro. Understand? No problem. Now this is your 2 lateral ventricles, okay, 2 lateral ventricles. Write it down simultaneously so that you not will confuse it. It's a lateral ventricles, okay. This is your third ventricles, okay, and 2 lateral ventricles, they are communicating with this third ventricles by a window, and this window is termed as the foramen of Monro, okay, foramen of Monro. So this is your third ventricle. Now this third ventricles will communicate with fourth ventricle, okay. The third ventricles which is communicate with the fourth ventricle via one duct, okay, and this is called as the cerebral aqueduct, okay. Write it down. It is called as the cerebral aqueduct, okay, also called as duct of Salvarius, okay. In the exam, in MCQ, they put it we can say the cerebral aqueduct, okay, or duct of Salvarius. So don't confuse, they both are the same, okay, both are the same. And this duct, or we can say this is the one passage, okay, which help to link the third ventricles with the fourth ventricle, and this is your beautiful fourth ventricle. Fourth ventricles. Understood? Now, these fourth ventricles, they have one window, okay? They have one window, and this window is called as the foramen of Laska. Okay? See, here is one opening, which, yeah, this opening, and this is called as the foramen of Laska. Foramen of Laska. Clear? No problem. And this, you can say again one passage, okay, one tube like a structure, and this is called as the spinal duct. Okay, this is called as the spinal duct, and this is also, you can say, term as the central canal. This is also termed as the central canal. My friends, just it's easy to understand. In your brain, okay, or you can say in your central nervous system, there are some hollow space, okay, vacant space are present. Understood, first of all? And these spaces are mainly the four types, okay, and we term these hollow spaces as the ventricles, okay, we term these hollow space as the ventricles. Now, we have the two lateral ventricles, okay, because they are present sidewise, okay. We have the two lateral ventricles, understood, and these two lateral ventricles, they communicate with the third ventricles via one window, okay, via one window, because there is not a top gate, okay. Sometimes what happened, like when we make any kind of mistake, okay, and sometimes we have to only keep in our, you can say, home. So sometimes our friends come outside the window and they talk with us, okay. It's like the same. It's like the same. There is a one window, okay, which help to communicate with the third ventricle, okay, which help to communicate with the third ventricle. And these two, you can say, the foramen or window is termed as the foramen of Monro. That's all. Now, why you not think that why these two ventricles need to be communicate with third ventricles? Why they are not living as separate? There must be any reason, okay, why your friend is coming outside the window when they are not allowed to come from the gate, main gate. Why? There must be anything to share, isn't it? Same thing. These choroid plexus, okay, these choroid plexus, they are producing the CSF. Write it down. The choroid plexus, where is this? Yeah, the choroid plexus, they are producing CSF. Are you getting my point? Yeah. So they are producing the CSF. Understand? Now, if this CSF will not come in this environment, then what happened? The lateral ventricles will swell up. Yeah, it will swell up, okay, and it start compressing the surrounding brain tissue, isn't it? If these two ventricles, okay, we term as the lateral ventricles, where there is a choroid plexus is present, and if there will be a blockage, okay, and if there will be no any communication between these two lateral ventricles with the third ventricles, then the CSF will continuously form, okay, and these ventricles become enlarged, isn't it? These ventricles become the enlarged, okay, and that's a pathological condition, because that they start compressing the other brain tissue, the brain structure which is present around these ventricles. Yeah, isn't it? And this condition is called as the hydrocephalus. Write it down. This condition we will have discussed it in detail, but for a while you just understand it is called as the hydrocephalus. There are types of hydrocephalus, okay, there are types of hydrocephalus which we will discuss later. So sometimes it happen there will be a blockage due to the cancer formation in these, you can say, the window, okay. and there are other reasons as well. There are some idiopathic kind of hydrocephalus, understood. We will discuss it later, but for a while you just understand there is the one window, okay, I mean two window which communicate with the third ventricles. Now these choroid plexus, they will form the CSF, they drain via this window into the third ventricles, and through this cerebral aqueduct, they are passing and coming to the fourth ventricle. Okay, they are passes and coming into the fourth ventricles. Now you see this area here, the central canal which is present in the spinal cord region, yeah, this cerebral central canal. Now the thing is, if this cerebral canal, okay, and see, the thing you should remember in your mind is that here they are terminated, there is no further passage. It means there is again one need of kind of the window, okay, to circulate it. Now the window, as I shown you, it is present in the fourth ventricle, or we can say the cerebropontine region. This region where this window is present, this is called as the cerebropontine region. Now the fourth ventricles where this window is present, where they are draining this CSF, they are draining the CSF in this subarachnoid space, in this space. Okay, in this space, this CSF fluid is circulating. So they are coming via the foramen of Laschka. Okay, they are coming via the foramen of Laschka, and they are circulating. Okay, they are circulating. Understood? No problem. Once again, we are discussing about the CSF, and we call that CSF is a colorless clear fluid. It's a colorless clear fluid, okay, and it's a transparent, it's a colorless clear transparent fluid, and it's an extracellular fluid, okay. Then we seen that, okay, this CSF, as the name suggests, this is called the cerebrospinal fluid. It means it is also present in the brain region as well as the spinal region, okay. Then we go ahead and discuss that there are hollow spaces present in the brain or spinal cord, okay, and this is especially meant for circulating the CSF, okay, circulating the CSF. Then we think, okay, how many types of hollow space are present? So we told, as far as the CSF circulation is concerned, there are four ventricles are present, okay. The first and second, two are present in the lateral environment, two are present in the lateral side, okay, and these lateral ventricles, they are carrying one specialized structure, okay, which is master in the art of producing the CSF. Understood? The cerebrospinal fluid. Then we think, okay, if CSF is produced in these two lateral ventricles, it means it is not only kept there, okay, because they are forming, okay. And if you talked about the rate of CSF formation, write it down in per minute, 0.35 ml per minute, okay. In 1 minute, 0.35 ml, you can say the CSF is produced, and in one day, or not a one day, my friend, it's a 24-hour or one day, the same thing, the 500 CSF, okay, CSF is formed. Understood? Are you getting the writing? Not writing, then verbally I am dictating. Write it down. As far as the rate of CSF is concerned, in 1 minute, 0.35 ml of CSF is produced. Understood? So you are wise enough, you can calculate in 24 hours how much 500 milliliter, or you can say the half liter of CSF is formed, okay. Half liter of CSF is produced, but the actual volume of CSF which is present in this environment is 150 ml, okay, 150 ml. It means 3 to 4 times in a day this CSF is absorbed and formed. Are you getting my point? Because see, the 5 ml is total. If this rate, we consider this rate 0.35 ml per minute, it means in 24 hours, the 500 or half, you can say liter of the CSF is found, and but the actual volume of CSF if we measure, okay, it is only 150 ml. It is only 150 ml. It means 3 to 4 times there will be a replacement or reabsorption, okay, and formation of the CSF in one day. Understanding till here? No any doubt? Now just hand by hand you just also remember the specific gravity. The CSF specific gravity is equal to the specific gravity of water. Okay, so its specific gravity is 1.01. Understood? Later on in this lecture you come and understand that due to their specific gravity which is equal to the water, your brain are floating in the CSF. Your brain are floating in the CSF just because of their specific gravity. Understood? No problem. Now come to the once again in the diagram. We are discussing the ventricles, okay, and we are here in the fourth ventricles. Now the fourth ventricles communicate, okay, with the subarachnoid space via the foramen of Lashka, okay, and there is one more foramen present here, okay, which drain into the central canal, and this is termed as the foramen of mesentery. Write it down. This is termed as the foramen of mesentery. Are you getting my points? Yeah. Now the CSF which comes into this subarachnoid space, they are traveling, okay, but where they got absorbed they got absorbed in the supratentorial region of the brain, and you know it, the dura mater have the two kind of reflection I already discussed with you. The first is called as the dura venous sinus, understood, and another one is called as the to falx cerebri and tentorium cerebri. That's a dural reflection. So here only in the durus venous sinus, okay, they got absorbed by the arachnoid villi. So write it down. Absorption of CSF is done in the dural venous sinus. Absorption of CSF is done in the dural venous sinus by a specialized structure that's called the arachnoid villi. That's called the arachnoid villi. And sometimes this arachnoid villi, arachnoid granulation, you can say, see, this is your drainage house, okay, dural venous sinus, and there is a presence of arachnoid villi. Okay, these villi are specialized to take the CSF and drain into the dural venous sinus. So sometimes there will be a obstruction or tumor formation, okay, and the consequence is there will be accumulation of the CSF, okay, in this environment. Understood? Now this is about the CSF, their circulation, absorption, understood, and we also talked about their we can say the properties, about their rate, 0.35 ml per minute, okay, in 24 hours it's a 500 ml, but the actual volume of CSF is 150 ml. It means 2 to 3 times it got replaced, and their specific gravity is 1.01, and if their chemical nature you talked about, they are alkaline. They are alkaline. CSF fluid is alkaline. Clear? Understood? No problem. Now once you understood about the basic outline, the function properties, okay, properties and the formation side, okay, and the circulation side, now let's move ahead and discuss about their composition first. CSF composition. This fluid is very unique fluid, okay, this is very unique fluid, not only just because of their function. I am saying it's unique in terms of functionally they are important, okay, functionally they are very, very important, but you can say the research wise, the modern research, okay, they are also holding some uniqueness which we will discuss in this lecture. So we are discussing about the composition Composition of CSF. As I said, it's an extracellular fluid. It means there must be a higher amount of water here present. Okay, so there is a approx 93.03% water. Okay, and rest how many you can estimate? It's a 6.07, 6.07, isn't it? It's later, sorry, 99.13% water. It's a 99.13% water, and the organic part, okay, the inorganic part, or you can say the solid part, is present 0.87. okay, solid how many? 0.87%. okay, now in this solid there is a presence of organic part, okay, and there is a inorganic part. Now you write it down. In the organic part, okay, there is presence of protein, amino acid, sugar, okay, some metabolites like uric acid, understood, cholesterol, creatinine, and lactic acid. Once again, in the organic part of the you can say the CSF, they holding the protein, okay, amino acid, sugar, cholesterol, urea, uric acid, creatinine, and lactic acid. Whereas the inorganic, they are containing the sodium, calcium, potassium, okay, chloride ions, understood. These are the parts of the inorganic composition. Now the thing which you should have to remember is that there is no any lymphocyte is present in the CSF when they are, you can say, secreting by those special choroid plexus. There is no any lymphocyte, but when it comes to the spinal cord region, there are some lymphoid, you can say the lymphocytes, they are present, first of all. Second one is that there is no any presence of other cells, no cells, okay. This fluid is a clear, okay. Now the another thing is that this fluid's composition is necessary to know, just because their changes indicates the diseases. Their changes indicate the diseases. Like sometimes there is a, you know how the CSF is taken? Yeah. Did you heard about the lumbar puncture? Okay, come here. Do you heard about the lumbar puncture? Yeah. See, lumbar puncture are also called as the spinal tap test. Spinal tap test. See, this is one kind of invasive procedure. This is one kind of invasive, means you are you can say performing this procedure inside. Okay, understood? That's an invasive procedure. So it's a one kind of invasive procedure, okay, which is widely used, okay, in the some of the neurological diseases, suspicion, if the patient is suspected with the neurological problem, okay, understood. And sometimes in the when the intracranial pressure is raised, we already talked about the intracranial pressure. What is meant by the intracranial pressure? Intracranial pressure means the pressures which is exerting by the CSF and the brain tissue on the wall of, on the wall of skull. This is termed as the intracranial pressure. So when the intracranial pressure is, you can say, there is status checking, okay, there is status checking, because a high intracranial pressure is contraindication of the lumbar puncture. You cannot perform the IC lumbar puncture while the patient has the increased intracranial pressure, okay. And there are some signs and symptoms via which you can know that the patient intracranial pressure is raised, and you cannot perform the lumbar puncture. And those are, first of all, is the you heard about the projectile vomiting? Yeah, write it down. projectile vomiting. Okay, I will tell you what is mean by the projectile vomiting. And another is the papilledoma, and you can see the headache. Okay, these are the, you can say, the three things by which we can understand that patient intracranial pressure is raised already. We are not allowed to perform the lumbar puncture. Okay, first we have to decrease the ICP by giving the saline. Okay, giving the saline, like you just you know about probably it about the hypertonic saline. Hypertonic saline have the high concentration of the salt which pull out the water, okay, and decrease the intracranial pressure. Okay, decrease the intracranial pressure. But how you know that patient have the increased intracranial pressure? The first one is the projectile vomiting. Projectile vomiting is a, you can say, a specialized kind of vomiting. Like if you vomit, okay, it will goes like in a projectile motion. Okay, it will make the one arch, that's called the projectile. Second one is the papilledoma. Through the ophthalmoscope, okay, you can see that the optic disc is a swollen. Optic disc is a swollen. Another one is the headache, or you can say the severe headache. Okay, these are the some signs and symptoms of increased intracranial pressure. And remember that increased intracranial pressure, okay, and pregnancy, these two things are contraindication. In these two conditions, you are not allowed, you are not supposed to perform the lumbar puncture. Now come to the point, we are discussing about the lumbar puncture and the spinal test. They are also termed as the spinal tap test. Okay, as I said, it is an invasive procedure. Okay, and another thing which you should remember in your mind is that spinal cord terminate at L3 level, L3 vertebra. Okay, L3 vertebra, the spinal cord is terminated. Okay, spinal cord is terminated, and you see that this is a space of the meninges. Okay, so you have to perform this lumbar puncture, okay, into the L4 or between the L3 or L4 or between the L4 or L5. In these two reasons, okay, you have to insert one sharp needle, okay, one sharp needle. But first you have to mark the position. Okay, patient is advised to bend. Okay, their knee should touch with their chin. Okay, and we mark the area, and that area is called the iliac crest area. Okay, iliac crest area. Then through the antiseptic solution, first we mark, then through the antiseptic solution we clean those area and insert the you can say the needle. Okay, and take 5 volume 3 or 4. Okay, it's a 4 container. Okay, 3 milliliter, 3 or 4 container. You take the sample of the spinal cord. You can also check by the manometer, you can also check the pressure. Okay, generally the spinal cord pressure is varies, okay, according to the patient position. Spinal cord pressure or is varies. Okay, spinal cord pressure is varies. Like in the lateral recombinant position, which is the most preferable position for performing this lumbar puncture. Okay, here the 10 to 18 centimeter, the pressure should be 10 to 18 centimeter. While patient is lying position, it's a 13 centimeter. When the patient is sitting, it's a 30 centimeter. Okay, along with that the cuffing. Okay, coughing, you can say the weeping, they are also increases elevated the pressure. Okay, they also elevated the pressure. Understood? So patient is lying down on the couch. Okay, knee chest bent position. Okay, iliac crest area as marked, and the needle is inserted, and in the 3 or 4 container, the spinal cord is collected. Understood? Now, in this procedure, you can say the most important thing is you have to communicate with patient. Okay, you have to communicate with the patient, and without anesthesia you are not supposed to do this procedure, because this is a highly painful procedure if it is not you can say done, okay, under the anesthesia, okay, under the anesthesia. So you have to communicate with the patient, tell the procedure, okay, and well, because their cooperation can help to perform successful this procedure. Understood? That is called the lumbar puncture. Now, the collected sample, okay, collected sample have to be checked, okay, collected samples have to be checked. As I said that normally there is no any cell content, okay, and the lymphocyte amount is also less, okay, the lymphocyte amount is also less. So you can say in this container the samples of the CSF, if there is a yellow CSF, that's called the xanthochromium, write it down, that's called the xanthochromium formation. This xanthochromium formation tells that there is a hemorrhage, okay, there is a hemorrhage in the subarachnoid space, okay, and that's called the subarachnoid hemorrhage. Write it down, that's called the, it's called the subarachnoid hemorrhage. So this is the one, you can say this is the one kind of indication which shows xanthochromium, which shows in the case of the different kind of meningitis. We discussed already about the meningitis. There will be a presence of some you can say the lymphocytes count, which is generally less, okay, 5 milli per cube liter, but their number goes high. In the case of bacterial meningitis, okay, in the case of bacterial meningitis. Sometimes in the viral meningitis the immunoglobulins is elevated. So the composition of CSF is very much to necessary to understand, just because of their clinical correlation, or you can say the clinical point. So once again we are discussing the composition of the CSF, and we divided the CSF composition into the two parts. We said that 99.13% is the water, and the rest 0.87% is the organic and inorganic, that's the solid part, okay. Now organic parts have the protein, okay, amino acid, understood, then urea, creatinine, understand. Now the inorganic part contain the electrolytes mainly, okay, inorganic part that contain the electrolyte. Now the clinical importance related with the composition of CSF is that generally there is no any cell, okay, there is no any cell is present in the CSF. As I said, the CSF is a clear, colorless, transparent fluid. Now the lymphocyte comes when the CSF is drained into the spinal region, okay. Now there is a one procedure via which, there is not only one procedure, my friend, there are two procedures, okay. One procedure I described, first I will revise it. So there is a two procedure, okay, by which we can take the sample of the CSF, okay, and analyze it laboratory. Now the first procedure is our lumbar puncture, also called as the spinal tap test, understood, and this is an invasive procedure, okay, okay. There is the one, you can say the most preferable position, that's called the lateral recumbent position, okay. Patients have to lie down on the couch, okay, their chin and their knee should be touches, okay, and we mark the region that's called iliac crest region, because in that region the spinal cord is terminated, okay, above in the L2 or L3 vertebra. So we have generally prefer the L3, between the L3 and L4, or between the L4 and L5, okay. Now, okay, we under the anesthesia, we collected the sample. Generally the 3 or 4 you can say the container of spinal cord is collected, understood, and this performing the lumbar puncture is contraindicated under the in the increased cranial pressure patient, okay, you can say the intracranial, increased intracranial pressure patient and pregnancy, okay, in pregnancy, and also when the patient is undergone recently any brain surgery, okay, on that times you are not supposed to perform this. And in the case of the hydrocephalus, okay, severe hydrocephalus, okay, this is contraindicated, understood. So there are the signs which indicate that the patient have the increased intracranial pressure, that is the projectile vomiting, papillodoma, headache, okay. These are the 3 signs, understood. Now the taken sample is analyzed laboratoryically, and there is seen that if there will be a yellow coloration, that it is so there is a subarachnoid hemorrhage, understood. And if there will be a high level, the lymphocyte level is elevated, that shows there is a meningitis. If immunoglobulin level is increased, that also shows the brain have some kind of inflammation. And generally the pressure of the CSF is varies, okay, according to the position, according to the patient activity, okay, according to patient activity. Now as I said, there are 2 procedures. The first one is called the lumbar procedure, okay, and second down, just you write down, the second is called as the cisterna puncture, okay, through the occipital bone, okay. There is a fluid filled cisterna magnum region, okay, and in this region we inserted a needle and take the sample, okay, and this test is called as the cisternal puncture, okay. It is same as the lumbar puncture, cisternal puncture, but the difference is it is done through the occipital bone. It is done through the occipital bone. Understood? Clear? No any doubt? Now, till now, what things we discussed? We discussed about the introduction, properties, composition. Now, we are left with, we also discussed the circulation. Okay? Now, first we will deal with the formation, okay, and the function. Okay? Formation and the function. Till here, no any doubt? Yeah? You have any doubt? No? Thank you. If you have any doubt, you can comment down. We would like to answer your queries, answer your doubts. Understood? No problem. And I hope you all are fine, well, healthy, happy. Okay? So now discuss about the formation, okay, formation of CSF. Formation of CSF is done, okay, but regarding this formation of CSF and absorption of the CSF, there are theories, okay, there are theories, okay, and these theories are called as, first theory is called as the bulk flow theory, bulk flow theory, okay. Another theory is called as, yeah, first one is the bulk flow theory, and also another theory is called as the third circulation theory. Third circulation theory, okay. And the recent theory which challenging these theories is called as the glyphatic system, okay, glymphatic system, and also called as the okay, and another which is challenging these theories is called as the dural, yeah, it's called as the it's called the dural lymphatic drainage, okay, dural lymphatic glymphatic, GL, okay, the spelling is wrong. Glyphatic system, okay, and another one is your, another theory is called the dural lymphatic drainage. Okay, another is called as the dural lymphatic drainage. So one by one we just understand the bulk flow theory as we discussed previously. This theory says that the formation of CSF is done, okay, or you can say the formation of CSF is done in the choroid villi, okay, choroid plexus basically, understood? And due to their concentration, okay, you can say through the pulling force they are drained into the dural venous sinus, okay. Now the third circulating theory, it suggests that apart from the blood and the lymphatics and the other, there are circulation of the CSF. There is the circulation of the CSF, understood? I'm just dictating their postulates, okay. I don't want to miss any points because this is highly important to understand. Now the third circulation theory postulates that CSF is mainly produced from the choroid plexus blood, okay, in the ventricles and flow in the one direction, okay. Let's draw the diagram so we have the better understanding. Okay, this is the cut section. Understood? This is a cut section of the brain, and here is your lateral ventricles, okay, and this is your, very good, cerebral aqueduct, okay, it's reaching the cerebropontine region, okay, and then central canal, understood? I should change the color. And see, and there is a choroid plexus, now the third circulation theory, okay, this third circulation theory, they postulate that the CSF is formed by this choroid plexus, okay, and they drain into the third ventricles, okay. This is your third ventricle through the foramen of Monro, okay. Through the foramen of Monro they drain into the third ventricles, and they come via the cerebral aqueduct into the fourth ventricles, and there is another foramen of Laschka, okay, which eventually open into the you can say the subarachnoid space. So this is your pia or pia mater, okay, this is your pia mater, and this is your arachnoid mater, and above the tough mother, which is forming the dural venous sinus, is your dura mater, okay, no problem. Now understand the concept. The third circulation theory, they state that the CSF is formed by these choroid plexus, they drain into the lateral ventricles, okay, and they again they drain into the third ventricles via the foramen of Monro, okay, and through this duct, that's called the cerebral aqueduct or duct of Salverius, okay, they drain into the fourth ventricles. That fourth ventricles have the opening which communicate with the subarachnoid space, okay, and here, and this is done by the foramen of Laschka, okay. Now the CSF is circulating, okay, understood, and they are drained into the dural venous sinus, okay. This postulate is by the third circulation theory, understood, no problem. Now bulk flow theory says that the ventricles, they are lined by the epididymal cell, that's correct, okay. The entire you can say the entire ventricles, they are lined by the epididymal cells. Now epididymal cells is a kind of neuroglial cells. Okay, it's non-excitable cells, and the specialist, you can say the specialization of this cell is that they are containing the minute cilia. Okay, as our respiratory system have the cilia, the same cilia is also present. Okay, the same cilia is also present in the epididymal lining. Okay, epididymal lining, and it's help. Okay, it's help their this cilia ciliary movements become, you can say, the active with the arterial pressure. You know that the brain have the one specialized collateral type of blood circulation, that's called the circle of Willis. Okay, that's called as the circle of Willis. Now, as I said in the previous class, that the circle of Willis is also present in the subarachnoid space. Okay, and you know that the 20% of cardiac output, okay, 20% of the cardiac output is going to supply the brain. Okay, means there is a high flow of the blood. Okay, and they create one kind of pulsation. Okay, so pulsatile movement of the artery. Okay, pulsatile movement of the artery create, you can say, one kind of flow to this CSF, and also the cilia move, okay, according to the pulsation of the artery, and they are going to drain into the dural venous sinus. This postulate is stated by the bulk flow theory. Understood till here? No any doubt? Yeah. Now, this is a modern research. The glymphatic system and the dural lymphatic system, this is a modern concept, and this is really need to understand. Okay, the glymphatic, you can say the glymphatic system. Okay, why the glymphatic system? Because they are derived from the glial cells. Okay, glial cells is also a kind of neuroglial cells. Okay, so glymphatic is the term coined word explain glial lymphatic role that washes away the waste product accumulated in the brain. Okay, this glymphatic system is basically a one kind of lymphatic system, glial lymphatic system. Okay, this is one kind of glial lymphatic system. Understood? Now, this system is mainly meant for, you can say, excreting out or cleaning the, you can say, the brain garbage. Understood? See, our brain have lots of interweaved connections, okay, of the neurons. They have lots of interweaved connection of the neurons, and these neurons, okay, they are producing some of the metabolites, okay, some of the excretory metabolites that need to be clear. Okay, in order to functioning the well, they need to be clear. Okay, and for that there are a small lymphatics, okay, which is present, and that is termed as the glymphatic system. That is termed as the glymphatic system, and these systems are, you can say, cleaning these debris, and basically about, you say, write down beta amyloid body. See, in the case of Alzheimer's, the beta amyloid body concentration become high, okay, beta, and result into the dementia, some of the motor, you can say, abnormalities. Understood? Cognitive functions impaired in the case of the Alzheimer's. So in the glymphatic system, what is happening? These system are basically a lymphatic system, okay, which is done by the glial cells, okay, which is done by the glial cells, and these systems, they are taking the brain excretory materials, okay, and throwing out, okay, throwing out to where? They are draining their excretory material into the, into the lymphatics, okay. This is called as the glymphatic system, and this is the newly in 2015 it is discovered, okay, it is discovered, and their discoveries is done by the Professor Elif and Professor Nethergarden at Yale. Understood? No problem? Yeah, and this system is mainly activate while we are in a deep sleep. That's the deep sleep. You know, the sleep is divided into the two types, random eye movement and non-random eye movement. So this system is mainly activated in the random eye movement time. Okay, that's why the sleep is considered as a good, because the brain will clear their garbage while we are in deep sleep mode. While we are in a deep sleep mode, through this newly discovered system that's called the glymphatic systems, brain, you can say, discard their excretory discharge, okay, clear themselves, and in morning we feel good. If we take in the sleep, then we feel good, okay, because these systems are mainly activated while we are in a deep sleep time, okay, deep sleep phases. Okay, another one is called the dural lymphatic drainage. Okay, another one is called as the dural lymphatic drainage. This is discovered in the 2015 by the Professor Kifnish and Dr. Lounges. Okay, Dr. Lounges. Understood? No problem. Okay. Yeah. So cerebrospinal fluid production and absorption is significantly, you can say, change. Okay, their concept is continuously changing from the third circulation theory to the lymphatic system to the dural lymphatic drainage. Understood? Now, once you understood all these things, now come to the point and discuss about the function of CSF. Okay, function of the CSF. See, the function of CSF first is the protection. Okay, second is providing the, you can say, the exchange system, act like an exchange system. Third one is maintaining the volume. You can say the maintaining the pressure, intracranial pressure. Now, first, protection. You know that the CSF, as I said, it's a clear transparent fluid, okay, and it is present in the subarachnoid space. Understood? So sometimes what happened, due to the heat on the brain, okay, brain will try, you can say, the cranium is hard, okay, but brain suddenly shift, okay, and if there will be no any CSF on that area, it means there will be the rupturance of the artery, result into the kind of, you can say, the hemorrhages. Understood? So just because of the CSF, okay, there will be no any more jerkness, okay, there will be no more jerkness. That's the first. Second thing is about the specific gravity. As I said that the CSF specific gravity is equal to the you can say the water specific gravity. Understood? And that's why our brain is floating. You know that the brain actual weight is the 3 pound, okay, which is in kg it's the 1.5 kg. It's the actual weight of the brain. But just because of the CSF, we only feel the 50 gram of the weight. See, that's why initially I told you, no, these fluid are very unique fluid. Understood? Now, second thing is the exchange system. Brain, you can say, excrete out, okay, they discharge their excretory material through the CSF, okay, through the CSF, because CSF is the one that penetrate in the brain, you can say, the deeper layers. Understood? Now, it's also maintaining the volume and the pressure. CSF also maintaining the volume and the pressure inside the, you can say, the brain cavity or cranium cavity. It is a function of the CSF. Understood? Now, as I said, there will be the abnormality. The first one is your hydrocephalus. Okay, this hydrocephalus is, you can even break the word. Hydro means water, you know it, hydro means water and cephalus in this region. Okay, when there will be accumulation of CSF, okay, if there will be not a good absorption, or you can say if the poor absorption of CSF, okay, then on that condition, okay, our ventricles will swell up as we seen initially, okay, and that result into the hydrocephalic condition. Understood? And there are types of hydrocephalus. There are types of hydrocephalus. We term as generally the primary hydrocephalus, secondary hydrocephalus. Okay, the primary hydrocephalus is a known, you can say the idiopathic type of hydrocephalus where the cause is unknown. Understood? And the secondary hydrocephalus is due to the meningitis. Understood? Due to the subarachnoid hemorrhages. Understood? And there are some of the congenital defect in the child where the cerebral aqueduct become narrow, okay, too much narrow. Understood? There is no any passage. Okay, these conditions are called as the secondary hydrocephalus. Now about the treatment, mainly their treatment is done sometimes by the surgery or sometimes by the shunt. Shunt means you are inserting one kind of pipe, okay, that's called the arterioventricular shunt, and you are directly draining those CSF. You are basically changing the path, altering the path. Okay, understood? This is called the arterioventricular shunt. Understood? So by this we covered today's portion. So let's summarize it once again. We dealt with the introduction, okay, of CSF, then properties of CSF, composition, formation, their absorption, function, understood, their circulation, and some of the abnormalities, basically the hydrocephalus. We will cover the hydrocephalus in detail in our further lectures. Okay, understood? Hope you understood today's class. So thank you with having me. Bye. Have a nice day.